Good morning, Sasha. My name is Michael. I'm a nurse here at Excelsior University Medical Center. I know that you're really excited to go get discharged tomorrow, but I'm here to go over some discharge teachings that before you go home. Are you comfortable to do this right now? She says yes. So let's go over the topics that we're going to go over. At any point where you have some questions, don't hesitate to ask. Stop me and ask the questions. So the topics that we're going to be going over are discharge information, discharge medications, when to call 911, when to call your PCP, and then the two topics that we're going to be going over are deep vein thrombosis, pulmonary embolism, and postpartum preeclampsia. So are you ready to get started? So the first thing we're going to do is discharge information. So we're going to have a follow-up with Dr. Denali 2 weeks. They're basically going to be looking for the incision site. So right now you have no diet restrictions. Please do not lift anything larger than your baby's weight. Nothing should be inserted in the vagina for 6 weeks. And you may not feel comfortable in driving because you have to twist and turn to look at the blind spots and also apply brakes. So be mindful of that. So next topic we're going to be going over is discharge medications. So take the continuous prenatal vitamins that you've been taking throughout your pregnancy. For pain, you can take Motrin 600 milligrams every 6 hours, or you can take Tylenol 325, 2 tabs for pain every 6 hours. For bowel regimen, you want to use doxysodium. So this is going to soften the stool, and this is going to prevent any stress or any straining. So to call the reason to be calling 911 is if you have any shortness of breath or any chest pains. You call the PCP if you have any signs of infection. This means that if you have a fever of 100.4 degrees Fahrenheit or greater, you call the PCP. If you have any swelling or discomfort in the incision site, it's warm to touch. Any pain that isn't relieved by the aforementioned pain medication like the Motrin or the Tylenol. The other times that you would call the PCP is when there's excess vaginal bleeding, and this means when there's one pad an hour for 2 hours. One pad is saturated for an hour for 2 hours, and then passing blood clots that are larger than the eggs, and mood changes, and any severe headaches and visual changes. And we also want to look out for any swelling in the hands, eyes, or face. Okay, so patient teaching, we're going to be going over deep vein thrombosis / pulmonary embolism. So blood clots occur when there's a damage such as a cut. Blood clots stop the bleeding. The reason for the blood clots formation is usually in the legs due to inactivity, may it be in the surgery, pregnancy, or on long flights. So risk factors are pregnancy, smoking, obesity, birth control, and surgery. To prevent this from happening, make sure you're walking around, moving around, and stretching out your muscles. Never try to cross your legs because this prevents blood flow through the legs. Compression stocks may be used to combat this. So the next topic we're going to be going over is postpartum preeclampsia. So by definition, postpartum preeclampsia is a rare condition that occurs when you have a high blood pressure and excess protein in your urine soon after birth. Preeclampsia is a similar condition that develops during pregnancy and typically resolves with the birth of the baby. Symptoms include severe headache, visual changes, high blood pressure, which is hypertension, which is 140 to 140 over 90 or higher, decreased urination, pain in the abdomen, shortness of breath, nausea, vomiting, and excess protein in urine, also known as proteinuria. So some risk factors include family history of hypertension, diabetes, obesity, and having twins or having multiples, so having triplets and so on. Preventions may include taking baby aspirin for the next pregnancy, eating healthy, and changing your lifestyle. So actively exercising can prevent postpartum preeclampsia. So we have finished the teaching. I know that I've thrown so much information to you. So do you have any questions? Um, so obviously gave you a lot of information. I'm going to give you a packet tomorrow, right now, to go over. I'm also actually going to ask you, to make sure that you understand and evaluate the information. I'm going to ask you a couple of questions. So these questions include, what have you learned from this discharge teaching? So she goes over everything that she's learned. What are the things you already knew and the things that you gained from this teaching? And then she's going to repeat what she learned so I understand that she knew the information. So Sasha, thank you for your time. Congratulations, and I'll see you tomorrow for the discharge. And have a great day.